be a hybrid of in-person and virtual visits, but we're not quite sure if that's going to happen yet. So the first thing that we have listed is our advocacy basics training. And if you haven't already, highly recommend that you take this. It's like a 45-minute course with a certification at the end. And like I said earlier, it really gets into detail about how to convince your legislator and how to engage them, and truly how to make advocacy part of your legislative motive. Um, I think I'm just going to try and click and show you guys super fast. But this is what it will look like. These are other courses on the left, but this kind of is just an overview of what the training will look like. And there's some really interesting information in there. And it's pretty engaging and fun, actually. And then, of course, finding your legislator. So this is important as well, just staying up to date on who is current and who is in your district. That is here, this website. You can also use the PACT website. We have a website build that will help find your legislators based on your address, but this is helpful also. We use this a lot to look at certain committees and appropriation lists. So just wanted to show you guys that for getting your toolkit all together. And then, of course, we have the PACT site, and this is where you can find a lot of your materials that you'll be using. For example, I just have it linked right now to like program funding. So obviously PACT's ask of maintaining level funding. And then over here on the right in this light blue box, we have all of our infographics that you can easily download and share to legislators. So for example, here is our one-sheeter about funding tobacco control programs to protect lung health. And then also on the next item on the slide, I have to join PACT. So if you guys haven't already, please join PACT to stay in touch with us about any policy or legislative updates and just general news in the tobacco control world. And then after your legislative visit, we want to make sure that we highlight how reporting your legislative visit is really important, especially for your region. This is a way for us to kind of see who you've talked to, and it helps us compile that data for Day at the Capitol. So when you get assigned a team and you are working with other people in your district, or you're talking to someone whom you may be a constituent for, this is why. It's because of the legislative visit tracking. And it's really basic. It's just kind of like a survey about how your visit went. I'm sure many of you are familiar with it. And this is kind of what it looks like. And yeah, so I just wanted to kind of go through the resources that you need to get started. Let me know if anybody has any questions thus far. So if you're familiar with Day at the Capitol, you know that ALA kind of likes to break things down in a legislative visit into roles. And it's very simple, but it seems to be what works. One is just like a general introduction. Legislators want to know who you are and why you're there. Any materials or statistics you may have. Usually when I'm doing a legislative visit, I have like 5 stats in my mental Rolodex ready to go at any second. And that's usually about funding or any other pressing topic. Like in the past, it's been Tobacco 21. I'm sure in the near future, it'll continue to be about funding, and then point of sale as well one day. I'm sure we'll all be fighting for that. And then a personal story. This just means any reason why, any story behind how tobacco has affected you. Legislators sometimes won't give you the time to say all of these, wonderful things. And I think it is really compelling. And in advocacy, you're definitely encouraged to be a storyteller of why something is important to you. So we kind of have that in the middle if there's room for it, but not necessarily at all legislative visits is there the opportunity to share that. So I look forward to sharing it when I have the chance. Um, and then, of course, the ask/summary. So it's super important when you have a legislator's ear to make the ask. We want to make sure that they know exactly why we're there, and we want an answer about how they feel with all of the things that we had presented. Um, it's unfortunate. Sometimes you won't get an answer. You won't get any commitment, and that's okay. That's part of the process. That's why we have you track what happens during your visit so that we can go forward and figure out how to convince that legislator a little bit more, how to turn up the heat on them, if you will. So this is kind of just a breakdown of how we usually have a visit move. So you introduce yourself, obviously state the reason why you're there. Hi, my name is Natasha. I'm here today because I'm concerned about the e-cigarette epidemic. That's just like an easy way if you're making calls to get someone's attention and to just kind of get the tobacco control word out there. We have a lot of materials, and so I include the PACT site for basic materials, but trueandpa.org also has some amazing materials. They're sometimes more focused on youth advocacy and Day at the Capitol, which is why I didn't include them in our original resources. But even though they're made for like teenagers, they are really resourceful and helpful, like the fact sheets that you can kind of fill out yourself and infographics and things like that. It's super easy to be able to distribute those, and they're very impactful. Obviously, making your ask is huge. That is the point of your legislative visit, and it's one of the most important legislative tracking data points. And here's the ask. In the past year, we have asked our legislators to maintain funding, and I prefer that language personally instead of preserving, because I feel like maintaining insinuates like to continue what we've been doing. And in the climate of funding right now with our government, I feel like that has been really helpful. So when you look at all the resources and within the advocacy training, you'll see too that maintaining is kind of like our new keyword. And these are the true infographics and practice worksheets that I was talking about. And as you see, like a lot of them talk about Tobacco 21 and kind of give room for the individual to be their advocate for their tobacco control issues. But I think that it's really helpful to look at it this way in the 5 Ps of persuading for policy. And so I've included the link here to the True website where you can find this information, but I just like to include it because I think it's eye-catching and helpful. So that is what I have for you guys. And like I said, the homework is going to be key. If you have any questions about any of those links or anything that you saw that you can't find again, please do reach out. And any questions that you may have in general about legislative visits, we're always happy to help. And very, very soon we'll be getting our hands into the Day at the Capitol planning for this upcoming year. So mark your calendars for May 4th. We're not quite sure if it's going to be fully virtual or kind of like a hybrid event, but we're looking forward to it, and we really appreciate your support and you guys organizing to make your legislative visits stronger. I think that that's really great. So please do let me know if you guys have any questions.
Natasha, you'll be sharing those slides with us.
Yes, sorry, definitely.
I saw you nod your head, just couldn't hear you.
Yeah, that's something I always do for some reason. I'll just be nodding on the other line. But yeah, I'll share the slides and then you'll have all of those links and resources, and highly encourage the advocacy basics. Definitely. It's our most current training, and I feel like it's the best we've ever done in terms of facing those barriers of any legislators who are not supportive or not committal, and just how to maneuver those conversations.
Great. I think we really wanted to just get a refresher for those that have been doing this for a while, but also we've welcomed some new subcontractors throughout the region. And I'm glad that we were able to have this scheduled with PACT. So that way, if there are asks between now and day at the Capitol, we know how to approach them. And now we have these slides to help us, navigate those conversations. So thank you so much, Natasha, for being here today. Does anyone have any questions for Natasha about anything she discussed or anything moving forward? Okay. Well, if you do have any questions for Natasha, we can certainly put you in contact with her and get those questions answered. So thank you so much, Natasha. Again, we really appreciate that everybody from both regions were able to hop on today for that training. And we will just move right along into our meeting then.
Awesome. Well, thank you again for having me, and please do reach out if you have any specific questions or concerns about legislative visits. And enjoy the study fund I've sent. I'll be sending you the PowerPoint, and you guys can check out those resources.
Wonderful. Thank you so much.
Thanks again. Bye.
Bye, Natasha. All right, guys, I'm going to share my screen with you just to go over the agenda items so that we can stay on task here. Okay, so no questions. So we're moving along to regional updates. So I just wanted to kind of touch base with you guys about YRBS surveys that are going out. I know some schools are responding, some are scheduled, some have been completed. Just quick reminders to make sure that you are in the classroom throughout the entire survey. Don't let the teacher leave. Make sure that the teacher stays in the classroom with you throughout the entire survey. If you have any questions after you've collected the surveys on how to get them back, please feel free to reach out to me or Adriana, and we can definitely help assist you there. Is there any questions about YRBS since we're on the topic?
Hi, Diana. I only have one question with the YRBS. So in Butler County, we on the one Excel sheet got 3 schools that were like chosen. But we've only heard back from one of them in terms of like you'd sent us saying they've reached back, they're ready to schedule. We got them scheduled and good to go. Do we just wait for you to contact us on the next 2, or what should our steps be with that?
Yes, so we are waiting for Department of Health to reach out to the school district and get permission to schedule. And then once the Department of Health has spoken to the point person at the school and said, yes, we're ready to schedule, then Casey and myself, or Adriana and Casey, will hear back that, hey, this school's ready to schedule, please reach out. And then we will make contact with you all depending on what region the school's located in.
Okay, perfect. I just wanted to make sure we weren't missing a step here, so we're good.
No, you're good.
Okay,
And
thank you.
they're wanting to have the surveys completed by the end of the year, so by December 31st. So hopefully the schools that are reaching back out to us and that are interested are, applicable and able to schedule in a decent time frame so that we can get them done. As far as the ones that don't respond, I'm not sure how we proceed. We'll just wait to hear from the state as far as the ones that aren't ready to schedule or maybe think that they don't want to have the survey done. So we'll be in touch if we hear anything along those lines, if the school is in your region or county.
Okay, thank you.
Absolutely. So any other questions about YRBS before we move on? Okie dokie. So there is a conference that is happening in State College next year, and there is a call for abstracts. I wanted to just make you all aware in case someone is interested in submitting an abstract. The Conference Sustaining Public Health in Pennsylvania is looking for abstracts to be submitted by November 19th by 5 p.m. And the topics that they're looking for abstracts on are community public health strategies, best practices in improving the health of special and underserved populations with a special focus on migrant and immigrant farm workers, use of data-driven and evidence-based practices in public community health, the intersection of public health and nutrition, and yeah, so those are the 4 that they're looking to have a strong emphasis on. I will send you all the link for the call. Yes, Paige, I will definitely get that out. We have the meeting minutes that are being taken, so I will send you the link to that. That way you guys can review the website and you can review the submittal information and make sure that you have all that. The conference is actually going to take place March 28th at the Penn Stater Hotel and Conference Center in State College. So it is in our state, and hopefully we will get some good submissions and get chosen and be able to attend and present. All right, any questions about the abstract information? Okay. Moving right along to true program updates. So I just wanted to touch base with you all about the true groups that have currently been registered. If you have visited the truandpa.org website, the map that they normally have up there showing the groups that are registered is not existing right now. And I'm not sure if they're doing website updates and they will put it back on late at a later date, but the only way that we can find out if true groups are registered is by contacting PACT and ALA directly and asking them. So that is what I did for the Southwest region. I'm not sure about Allegheny County, but what I would do if you are Allegheny County is certainly reach out to those groups that you are working with and maybe double check and make sure that they have registered. But just an FYI for Southwest region, we have 4 groups that are registered and they're all in Westmoreland County. So for those of you that are working with youth in all the other counties, can you please touch base with your true advisors from last year, making sure that they have re-registered. If they are having any issues with that, please reach out to me or reach out to ALA directly to figure out what that issue is and what that barrier is. But yeah, we definitely want to get those true groups registered. So if you need any help or assistance with that, please feel free to reach out to me and let me know. Okay. Any questions about True and program updates? No? Okay. So the Department of Corrections, their recovery project, this really only pertains to Greene County right now. So I just wanted to put that out there. Greene County SCI is ready to move forward with the Department of Corrections cessation efforts within their facility there. So please be on the lookout for those emails and those refresher trainings so that we are ready to go once we get the call that they have people on board for cessation training. All right. Last but not least, I'm not sure if you guys are aware of the Truth Initiative grants for helping colleges and universities go smoke-free. They are offering up to $20,000 in grant money for these particular colleges. And I do have a document that was sent to me about it. I'm going to put that out there in our meeting minutes email as well to give you more information. I know this campus initiative has started up again, and thankfully COVID is not interfering with that this time. We did have to put that on hold for 2020, but looks like we are starting to pursue that again. So I'm going to send you that information. If there's any colleges that you have in mind after you read that, please come back, let us know. Depending on the region, contact me or Adriana, and Grant can also help assist with any of that language or connections as well. All right, does anyone have any questions about those regional updates or anything they'd like to add for those topics? Okay, all right, let's move right into our provider updates. I was expecting PACT to present a little bit longer, so we are way ahead of schedule. I'm not ready for a break yet, so let's move right ahead with the provider updates. Sydney, I'm going to call on you first because you do have to hop off. So please go ahead and then just popcorn it to whomever you would like.
Cool, thank you. Yes, I have a cessation class at 10, so I just don't want to be late. Hi, everybody. Nice seeing you all again. So some of my updates are, I've just been contacting a lot of people that I met at health fairs or tabling events just to see if they're interested in cessation. I am currently working with IRMC, which is Indiana Regional Medical Center, and that is a group class. So that's really exciting for me. It's my first group class, so I'm really enjoying it so far. And we have that tonight. So that's our second class tonight. I am currently starting to work closer with our own medical offices in different counties, just with the NRT initiatives, motivational interviewing, things like that. I'm really excited to get that going too. And then I'm just kind of putting this out there to everybody. If you need any help with cessation classes, please don't hesitate to contact me. I will put my email in the chat in case you don't have it. But if you just need a virtual class, even if it's just a fill-in one time for week 5, whatever it is, just let me know and I would be more than happy to help. And I think that's it. I talk really fast. So I am going to pass it on to Carly. Carly, no, Erica. Sorry, I can only see so many names.
Sydney, I actually might be taking you up on that offer to do cessation because
I was thinking of you in mind, yeah.
Thanks. Because with the Great American Smokeout, we usually have a class that's scheduled so that when we do all of this related to the Great American Smokeout, we can push people right into that class. I am still currently looking for staff. So now my count is I'm hiring 3 people, if anybody knows anybody who wants to work. And one of my staff members has also submitted her notice. And so she will be leaving at the end of the month. So we're like desperate for people, if you know anybody who wants a job. So anyways, but I do have some people who had inquired. We've been directing people to the quit line. I was hopeful that we were going to get somebody on board and that we would be able to offer it soon. But if we could just schedule with you, I think that would be helpful. Take a little bit of that pressure off and not delay anybody actually participating in cessation. So there's that. I guess the big update that I wanted to give to everyone is just this initiative that's happening in our county. So is anyone familiar with Blue Zones, or the Blue Zones project? Has anybody heard of this before?
Yes, me.
Yay. So since not everyone said yes, I'll just give you this little rundown of what Blue Zones is all about. So their National Geographic had done this investigative story around where people in the world like live the longest. What were the highest concentrations of people who lived to be into over 100? And so they ended up finding these like 5 locations across the world, very different countries, very different cultures, but where they had these highest concentrations. And then they did some further research and ended up finding some commonalities between all of these cultures, these regions, and they call it the Power 9. So like there's sort of these 9 things that people that do them live to be the longest. And it's not just about like, oh, okay, these people exercise, for example. It was like regular natural movement is one of the Power 9. So like these were cultures where that's just the way that they operated. Either they weren't driving places or the jobs that they had a lot of natural movement, wasn't necessarily, intense, but they were moving and that kept them healthy. So a couple of years ago, there is a group in our county, a coalition called Fayette Living Well, and they wanted to explore the Blue Zones and about like making Fayette County healthier. So, I'm on board with this. I was there with wearing my tobacco hat because we have so many people who use tobacco products, and that's obviously one of those determinants of health, whether or not people are using tobacco. And so we actually, at the beginning of this month, this has been a process. So the concept is great, but to actually work with the Blue Zones people, it's an undertaking. It's a community level undertaking that has significant cost, significant time investment. And so we actually hosted them in our county. The 4th and 5th of October, they were here and started this assessment of Fayette County. And we're waiting for them to make some recommendations on what we could do to really like become a blue zone community. I'm doing that's not the most glowing explanation of how this works, but the point is that this is this huge community level project. Tobacco use for our county is a component of it, so I'm there representing those interests and involved. And now we're waiting for the blue zones to sort of give us this official recommendation. In essence, they tell us whether or not they feel that our community has the capacity to make the changes needed to sort of adopt this whole process. It's, do you have enough people who are invested to do this? Do you have the financial backing? Do you have the decision maker backing in your community? Because it's not just about physical health or mental health. Some of this is about like the physical environment, how people are there food deserts, and how easy is it for people to get to A to B? So it's this huge process. But that's taking up, a huge piece of what's happening right now in Fayette County. So really excited. Hopefully we're going to get some positive information from the Blue Zones people soon. So just wanted to share that. That's pretty much all that's really happening, other than, I need to hire someone. Send qualified applicants my way.
Thank you, Erica. I appreciate it. And we certainly will. And let us know if we can help. If Sydney can help with those cessation classes, please let her know.
Yeah, I'll get one scheduled with her, and then that way that's done. Okay, as far as who's next, yeah, it's difficult to see. I can't even see people's names, everyone's names. Let's go with what about Erica? We'll go to the other Erica. I don't even see if her camera's on. Oh yeah, there you are.
Yep, that's me. Hi, so I'm from Keystone Wellness Programs. I have a few updates from both counties that we serve, and Beaver and Butler. So for cessation, there are cessation courses going on. Amber could probably talk about that more. We went to Health Fest at Slippery Rock yesterday, and we had students that were actually interested in cessation. We had a good number of them taking flyers for whether it's people they know or mostly their parents that they're interested in quitting smoking. So that was kind of nice to see younger people asking about our cessation programs. On the 25th, we have 7 vaping presentations scheduled at Mars Area High School, which is in Butler County. And we're hoping to do a Red Ribbon Week activity with them during the class, as well as I want to discuss true advocacy with them to see if they're interested in enrollment. On the 27th, we have a Red Ribbon Week event at New Brighton Middle School. So we are going to have a few different stations, and it'll be, I think, about like 300 students in total, not all at the same time, but I'm really looking forward to that one because I think the kids will really enjoy it. Last night, we also attended YAP After Dark at Beaver Falls High School, and I spoke with the assistant principal, who's very interested in getting vaping presentations at the school, as he was telling me about how he wants to get suspensions down and everything for people who are getting in trouble vaping. So I thought that would also be a good opportunity to discuss true with the students once we get in the school and schedule those presentations. And that's all I have on my end, if Amber would like to add anything that I am missing.
Thank you, Erica. Sorry, my mic was not unmuting. Going back to Butler, we did wrap up our cessation group with Geyser Cessation. That is in Butler. So we're hoping to start another group with them. We worked with both the men and women, and they were really thankful for the resource. Continuing to reach out to different townships and municipalities regarding our YLAP policies and work sites also in Butler County. Erica mentioned our Red Ribbon Week activity with New Brighton. We're going to be taking the inflatable brain, which will be really fun and cool to do. And we also have some vaping presentations scheduled at Ambridge Middle School during Red Ribbon Week as well. And we just attended the Alquippa food distribution last Friday by the Pittsburgh Community Food Bank. So we handed out some different tobacco resources and some other resources that our agency provides as well. And I think we hit everything so far. Mandy, do you have any additional things to add?
No, I think you two covered it all. So I think we're good.
Except I'm on too. It's Hannah. My camera doesn't work on Teams. Teams is not my friend. It doesn't work with my computer. So they chatted about all of the fun and community-oriented things that we're doing, but we are also getting ready to attack Act 112 in our counties, which feels daunting but exciting. And so we are thankful to have some interest in our local law enforcement for the first time ever and being helpful with that process. So we are wrapping our heads around that as well right now and getting ready to start the enforcement checks this month or next. And that's really it.
Thank you, Hannah. It's nice to hear your voice. I wish I could see your face.
I know. I'm telling you, Teams does not work on my computer. I can only see you and Erica right now.
Oh,
so.
Well, thank you very much for your updates. Tammy, are you still on? I know she had to hop off early. I didn't know how early. Okay, she might have had to hop off. Anyone from Keystone want to pick someone to go next?
I'll pass it off to Courtney.
Okay, so big things coming next week with Red Ribbon Week. I'm going to be in a different school district every day doing either a presentation or a tabling event. So just getting prepared for that. I also started the youth behavior surveys. I did my first one yesterday, so that went well. So getting out there, getting those completed. I have enrolled a true group, an advisor in a true group, and like Diana said, it's also Westmoreland County. So she's excited though. Big things coming. One cessation client currently, he is an IUP student. He's on week 5. He's quit, so that's exciting. He is using the nicotine gummies and NRT, but I feel like he's doing pretty well. I think that's about it. Oh no, I did a presentation. Diana and I did a presentation last week at Hempfield High School with over 500 students, 2 separate vaping presentations. So reached a lot of youth, and I think that it went well as also. I think that's it. I'll pass it to Grant.
Find that mute button. Good morning, everybody. Thank you all for everything that you've been doing. I wanted to share with you that I'll be creating a monthly newsletter / email blast to support policy development in both the Allegheny and the Southwest regions. The idea being to create a monthly focus industry where we can target our efforts. Like this month, we would target accommodations and food services. Next month, maybe healthcare, social services type thing. That doesn't preclude anybody from continuing the work that they've been doing on policies that they've been working on already. It just gives us a way to support the language behind why is a tobacco policy important for that particular industry. So keep your eyes open for that. And let's still we're finalizing the date and time for a policy work group for school policies to talk about next steps for how to support students in cessation and prevention. So be on the lookout for that. I'm still working on that. I'll get it to you as soon as I can. And I'm going to, I saw Lindsay McCash post something, but looks like she's just updating via chat. Amanda, I think you're in Indiana.
Yep, thank you so much. So just a quick update, as everyone is aware, I'm crossing my fingers today on the downward slide of the COVID surge. So we did have a relative number of people who were interested in cessation, and Sydney so kindly stepped up to take ours because all of our staff that teaches smoking cessation is clinical and busy taking care of ventilator patients. So she can give you an update. I think we had 6 people register and maybe ended up with 2 people. So hopefully, as we get more people who are coming in and our pulmonologist is really promoting in the office, if we don't have the staff available, that Sydney will be able to accommodate them.
Thank you, Amanda. I know things are crazy there for you right now.
Just a little.
We appreciate you. If you have to hop off, please feel free.
Thank you.
Of course. Thank you, Amanda. I see Madison. Did you want to give an update for your region?
Yes, sorry, I was on mute. Updates because I'm doing more on the youth portion for this. Right now, I'm currently going to schools. I have some lined up. I still have to reach out to a few more schools out in Allegheny County, but right now it's more on the tabling end and still trying to get people to come to we have a virtual that's coming up on the 28th. I attempted to have a face-to-face one, but we're just going to keep trying hard to push this and go to the other organizations that deal with youth as well. So cross our fingers and hope that we can start getting people to attend and go from there.
Great, thank you so much. And then we have another Madison.
Hi, I'm also with Keystone Wellness Programs, and I'm new, so I've just been jumping and puppy dogging my entire team lately, just getting a hang of the new programs and jumping in different trainings. So yeah, I'm just doing everything that they said that they were doing and kind of getting a hang of it all. But it's nice to be a part of this and meet you all.
Very awesome. Thank you so much for joining us today, Madison. It is very nice
for having me.
Absolutely. And please, if you have any questions or if there's anything we can help assist with your training or, anything along the way, please feel free to reach out. Okay.
Thank you.
Absolutely.
I apologize. It's Hannah. I should have introduced you, Madison. I'm so sorry. Madison is going to be working on our tobacco programming in both counties and has a special interest in cessation counseling. So I'm looking forward to her getting more involved in that aspect of our programming.
Awesome. Happy to have you on board, Madison. Carlin, she's actually brand new this week as well. She's the new health educator for Allegheny County. So Carlin, if you just want to hop on and maybe talk about your experience thus far. I think this is your 3rd day?
Yeah, I started on Monday, so I'm very new. So it's nice to have someone else new, Madison. But yeah, like she said, I'm Carlin. I will be the health educator in Allegheny County for the tobacco cessation. It's been great so far. Everyone's been super welcoming. It's nice to meet all of you. It would be helpful if whenever you introduce yourself, you did say where you're from. So I got Keystone Wellness. But if you're from somewhere else, if you could just say, where you're from whenever you talk about what you've been doing, that would be very helpful. But I look forward to working with all of you.
Thank you, Carlin. Rachel, would you like to go?
Yeah, sorry, I'm so used to there being 8 Rachels in every meeting that I always hesitate. But a lot of you probably don't know me either. I'm the healthcare coordinator for Allegheny County. I've been here about 3 months, but a lot of your faces are unfamiliar. But just for an update, we are kind of reaching over 200 providers at Jefferson Hospital and kind of meeting them directly to just give them what Adagio does and hopefully train their providers on how to refer patients to the quit line. So that'll be a big project for the next couple months because, like I said, over 200 providers. I think they're at over 30 different locations. So definitely getting our name out there and seeing kind of like a face-to-face to hopefully get them interested in that. And other than that, I had my health disparities work group last week or 2 weeks. No, last week. And we had a really great turnout for that. So that was exciting. We had a lot of good feedback of people interested in getting their providers trained on the quit line. So definitely excited for that and excited to help Hannah next week for Red Ribbon Week. And yeah, that's my update.
Awesome. Thank you so much, Rachel. And moving right along, it is difficult to see who all is on the call and who was invited. So if you haven't gone yet, please feel free to speak up.
I can go. My name is DeJour. I'm from Duquesne University, the Center for Integrative Health. I'm the tobacco coordinator here. Some of my updates. So today I was supposed to distribute the YRBS to Fox Chapel. However, the materials arrived late. So we're trying to reschedule a date to do that. I had a meeting with Woodland Hills last week. They're interested in starting a true group at their school. So I'm in the process of trying to register that true group. They're also interested in implementing the in-depth program. So this morning I wrapped up the training on that. So they're interested in using in-depth as a diversion program for students who are caught vaping or having tobacco products on campus as an alternative to suspending them. So we're hoping to start that as soon as next week. They already have like 10 students that they're interested in referring to this program. We're also going to kind of revisit their policy because in our meeting, she discussed wanting to make the students participate in 2 true activities as a part of this diversion to their suspension. What else are we working on? Next week, we have a bunch of events planned for Red Ribbon Week. They're also interested in participating in the Red Ribbon Week activities. So I've been corresponding with them. We're also doing stuff on campus here at Duquesne in conjunction with our DU Cares program. What else are we doing? I'm trying to think of what else have I been working on. I currently have 2 people that are scheduled to start their virtual tobacco cessation class next week. And I have 2 people that are currently in-person tobacco cessation classes. And then last week I gave 2 individuals their certificate, the paper for their NRT. I have followed up with one of them. She's like doing okay, but it's still a struggle. But otherwise, just trying to get trained. I was kind of focused on the in-depth training so that I'm able to facilitate that at Woodland Hills. So now that I've wrapped that up, we can kind of get that started. But that's pretty much all the updates I have, unless you have something that I've missed, Paige.
No, I think that's it. The only other thing that I was going to say is we've been distributing an NRT survey just to really understand patients' barriers to receiving NRT and what that has looked like for them, currently and in the past. So we are actively getting that out there during outreach events, but I think that's pretty much it.
Oh, and then we have a training scheduled on Thursday to train our community health workers on the PA free quit line. So I just kind of modified and updated our training for that. So we're excited to train our community health workers so that they can refer additional people to our program while they're out in the communities that we serve. So
that's fantastic. Thank you guys so much, DeJour and Paige. That was awesome. If you guys need any help with anything, I know that I'm certainly interested in taking a look at that survey once you get some data from, the people that have had barriers receiving NRT. I think that information would be awesome to see what people have struggled with and see if there's anything that we can change in our methods to make it more available to them. So yeah, that's awesome. I know some of you have put some updates in the chat. That's fine. Is there anyone else that wants to share before we adjourn the meeting?
I can go. This is Katie. I'm with the Cameron Wellness Center, and we're with the Western Health System. So actually, we are running a hybrid class right now, which is definitely more popular in person. And so we have 9 people in person and 1 person that is virtual. And the one person virtual, we are trying to get them a little bit more engaged because the people in person are doing much better. So that is our max. We actually had 10 people, and that is our full max for the class. So we also are working with our corporate offices. So we are working to get classes at Washington County. They are one of our corporate clients, so we are looking to go there. We have been trying, they have been interested, they just haven't had anyone actually participate yet. So we are trying to get them involved. So we're looking to hold a cessation class with the county, and then also with potentially the First Financial Bank is one of our corporate that have discussed an interest as well too. We do have our January classes on the books, and we're going to be holding 2. And so we'll be able to have 20 people in our classes total, one at 12 p.m. and one at 5:30. I'm currently working with our cardiac departments, pulmonary departments, and family health. So they have really come a long way with being willing to participate with us. And so they pretty much are, as soon as we have materials available, they get it out to their clients, and we're getting calls from patients. So really doing well within the doctor's offices as well too. So those will be coming up the second week of January, and then we'll be finishing our current session in about 2 weeks.
That is awesome. I am shocked that you got the max amount of participants for your classes, because as you've heard, it seems like people sign up and then, 10 sign up and 2 show up. So that's amazing. And it's, it's refreshing to hear, but it's also like, well, the in-person classes seem like more of a draw for people, and they connect with those people that are in the class with them. So I completely understand that. Thank you so much. That's awesome to hear.
We did find that there's actually 4 ladies that signed up together, and so they missed one, and all 4 of them were out. And so the 4 of them signed up, and then we have 2 couples as well too. And so the majority of the class, they're in there with someone else, and so that's helping to hold them accountable too. We have 2 people that are in there as individuals, and they're definitely the 2 that are struggling the most. But the others that kind of have either a spouse or friends that are helping with them, that is what's helping quite a bit.
I wonder, even if someone has a spouse that smokes or uses tobacco products, but they don't themselves, I'm wondering if having that added support in the class with them, even if they don't need to quit, like having a partner to go through the classes together, I wonder if that would be more of a motivator to keep people engaged and to actually complete all 8 sessions. So yeah, that's something to think about. But that's great. I'm so happy to hear that. Good work in Washington County. Anyone else?
Yeah, hi. I'm Ashley Durham. I'm also from the Hugh Lane Wellness Foundation with Madison. She pretty much shared what's going on with our youth efforts. But today is also the start of our tobacco cessation course here. We actually start at noon today. Our head trainer, Joel Arney, is going to be leading that. We have, I think, 2 folks signed up for that right now. So it's that fingers crossed moment of like, will they both show up kind of a deal. So we're all really excited about it. And another quick update is we scheduled a quitline training with Hannah Bowden for November 4th to meet with our staff for like that 15, 20-minute training so that we all have a better idea of what's going on there as well.
Awesome. It's so great to hear all the work that you guys are doing throughout both regions. It's amazing. And it's nice and refreshing and kind of get your wheels turning to see if, if there's more stuff that we could be doing elsewhere. So thank you all for being on today and taking the time to share your updates. Anybody else?
This is Molly from the Cambria County Drug Coalition.
Hi,
Natalie wasn't able to hop on today, but I can update for everybody. As far as cessation classes go, we have scheduled with our Goodwill Youth Build program. So we have 4 kids in that, well, not kids, they're like between the ages of 18 and 21. So we have them, and then Natalie and I work together to reach out to all the different sectors, and we're hearing some good feedback from that. So we're hoping, especially with our healthcare sector, that we're able to get some more of those scheduled as well. And then as far as Natalie goes, she always has a lot going on. She's doing currently some more policy work with the different housing programs, and then also starting to work with a couple of the local farms that have like some agritourism stuff. So she's going to be doing some policy work with them as well, which is pretty cool, including my own. So that's fun. I'm excited to have that, you know, come about on our farm too. And then we also have Red Ribbon Week coming up too. So we have a lot of good stuff happening as well. So.
Awesome, Molly. Thank you so much. Oh, I think you muted yourself. Are you still talking or were you finished?
Oh, there you go. Nope, I'm good.
Your video may have been delayed, so.
Okay.
Okay, well, that's great. That's fantastic. And please let Natalie know if she needs any help of regards to policy work to reach out to Grant. He's more than willing to help with the language for those policies. So great work. If you could also ask Natalie to give me a call. I called her yesterday. I know she's super busy, but just put a little birdie in her ear to give me a call. So thank you guys. And Tracy, I think you were gonna go on for green.
I was. Every time I went to unmute, somebody started to talk. So we are currently, Shanna and I are currently busy getting ready for Red Ribbon Week. As I'm sure everybody else is, we have programs scheduled in our schools that include Why Animals Don't Smoke, as well as talking about vaping. I'm currently doing Catch My Breath with 8th graders at one of our school districts. And once we get through all the madness of that, we will be looking at the Great American Smokeout, focusing on some cessation. At that point in time, we're excited to get back into that as well as back into the prison. We're excited to start that cessation program again as well. We also have tomorrow, Shanna and I got invited to go to a summit for all of our county's township supervisors and officials. So we are attending that tomorrow, and hopefully we'll be getting some information out about YLAP and maybe get some interest in getting some more policies passed there as well. And I think that's all, unless Shanna has anything else to add. And she's yelling from her office saying, nope, that's all. So I think that's good for us.
Sorry. Awesome. Thank you both very much. I appreciate it. Is there anyone else that has anything to share? Okay. If not, we can wrap early today. My phone is just ringing off the hook. Natalie's calling me already. If anyone else has anything that they want to share for the good of the order, please feel free. If not, I will make sure to get these notes out to you along with the documents that I promised. And just keep in mind 2 more things. If you would like to get a proclamation written for GASO, I know we're kind of close to Red Ribbon Week. We actually have one that's already drafted for Red Ribbon Week. If anyone's looking to, you know, present that to the commissioners, please feel free to reach out to Grant. If you're looking to have one drafted for GASO, we can certainly work on that for you as well. So let us know. And then keep in mind that True had a really great idea about a true storm around GASO with the Post-its and holding up supported messages on Post-its. There was a document I sent out about that previously, but I will resend it with this email with all of the other information I'm sending. So if you guys need anything, oh, yes.
Logos? If folks can send their logos.
Oh, yes. Any of those people that have not responded with your logos, please send them to either myself or Adriana. For Allegheny County staff, please send your logos to Adriana. And I believe I might have received all of the Southwest, but if I am mistaken, please forward it to me as soon as possible. And I think that's it. If anyone else has anything they need to say or get off their chest for the day. Okay, well, I hope you all have a great rest of your week. It sounds like you're going to be super busy next week with Red Ribbon Week. I hope everything goes well. If you need any help or assistance with anything, please don't hesitate to reach out. Thank you all. Have a wonderful week.
Thanks, everybody.
Thank you.
Thanks.
Thank you.
Thank you.
For the rest of your day, everyone.